Good morning. Thank you everyone for joining us today. We are going to give the audience a few more minutes to trickle in before we get started. For everyone joining in, we will be getting started in a few moments. We're waiting for a few more registrants to join the session. We will get started around 10:02 a.m. Welcome back to everyone who joined us in past sessions, and welcome to everyone joining us for the first time. We hope everyone is staying healthy and safety during this time. My name is Camila Masson, and I am a research coordinator for the FIU Jorge M Pérez Metropolitan Center. I'll be one of your co-moderators this morning. Before we begin, I will briefly introduce today's webinar, the COVID-19 Economic Recovery Index, and introduction and discussion. Researchers at the center have produced presentations today to introduce our newly developed COVID-19 Economic Recovery Index. This webinar is being displayed through Zoom's video webinar mode, so panelists will be the only participants featured on the screen, and all attendees will be muted for the duration of the webinar. Attendees will only be able to communicate with the panelists through the chat. Our panelists will also be answering questions from the audience at the end of the session. So if you wish to ask questions, you can type them in on the Q&A feature on your Zoom window. We will try to get to as many as possible. We are recording this session, and we will be posting the recording on our YouTube page and website. We will also be emailing all participants a copy of today's presentation. Again, thank you so much for joining us today for this very important discussion. At the end of the presentations, Alexander Anaki will be moderating the Q&A portion of the webinar. I will now turn the mic over to our center's director, Dr. Howard Frank.
Camilla, thank you very much. Good morning, everyone. Thank you for being with us this morning. And I share Camilla's sentiments. I hope you're staying safe and well. We've been following COVID and its impact on South Florida since this started now almost a year ago. And we have held numerous webinars and written numerous policy briefs that deal with various aspects of how it has impacted South Florida: health, employment, unemployment, and wages. And this morning's webinar deals with a means by which the center is going to communicate and help build knowledge and understanding of what we're doing with following COVID and its impact on our community. So the question that I pose to you and I pose to those who are going to be looking at and examining our work in coming weeks and months: why develop this index in the first place? What do we hope to do? What do my colleagues and I at the center hope to accomplish in building this index? Well, I think that the answer is three-part. The first thing that I would like and we would like to do is present something that is integrative. Rather than blitz you and others with a lot of facts, some on health, some on economics, some on education, some on employment, we're really hoping to build an index that is integrative. It is, as I say here, a one-stop shop on the recovery status, so that in a nutshell, you get a quick and really readily understood measure of what's happening. The second thing is that it is comparative. We hope that by making it comparative, and here explicitly across the 3 counties in South Florida, Miami-Dade, Broward, and Palm Beach, and the US, we get to see how and in what ways these governments and these regions differ from one another, and what we can learn from being comparative. The last thing is this index is meant to be anchoring. In and of itself, the number that we will present monthly is only the tip of the iceberg. What we really hope to do is use the index as a means for doing deeper dives on various components that are leading into the index. We will be following up with quarterly reports that examine in greater depth the health drivers, the economic drivers, the employment drivers, and the housing drivers that are leading into the index score. And that will help us understand better what's going on with the economy, what's going on with housing, provide food for thought, and ultimately policy guidance for decision makers. And that is our intent. So today, the principles behind the index: my colleagues, Maria Ilcheva, Assistant Director, Dr. Ned Murray, the Associate Director, and Nika Zaranova, the Research Specialist, are going to lay out how this was constructed, why it was constructed the way it was, the data sources, how you can put it to use, and how this will be on our website for further dissemination. With that, I'm going to turn the floor over to Dr. Ned Murray, my colleague. Thank you.
Well, thank you, Howard and Camilla, and welcome everybody. We're quite excited about the rollout of the COVID-19 Economic Recovery Index, and as Dr. Frank had mentioned, also the quarterly report behind the numbers that will be releasing the first series in April. which we'll get into a little more depth. And we'll be speaking about that. Each of the following presenters will be speaking on that as well. So let me just go over a few items that I think are important in terms of what Dr. Frank was alluding to, and that is the purpose and how this all came about in the first place, but also some of the standards or precepts that we put in place as well. So let's first talk about the challenges. As Dr. Frank had said, we started this at the very beginning with a series of webinars. We sat around thinking in terms of what we could do to address this as a public university, as a think tank. So we began with the series of webinars, but as that went along, we realized that there was a real dynamic to not only the economics of what was happening, both in terms of the impacts on the economy and the community at large, but also the fact that COVID was really driving it. And I think you've probably all heard that phrase now, is COVID is the economy, and the economy is COVID. And we certainly have the data that shows that. And the following presenters will get into that specifically. So that has been the driver, unlike previous recessions, particularly the Great Recession of 2008, 2010. This one was very different, and I think we all know that now. And so the recovery is going to be much different. And I do hope that you all get a chance to read the policy brief we did along with this presentation, which gets into the recovery, which we're now projecting at this point to be more of a K-shaped recovery, which we can talk about later as well. The other challenge, of course, was, and once again, I think this gets back to what Dr. Frank was referring to, is the whole narration and display, because data is data, and it's not data analytics isn't always the most easy thing to follow. So we knew it was going to be very important for our viewers in the community to be able to access this and for us to be able to provide a narration and a display that would be very comprehensive, but also comprehensible. So that was a very important challenge, and we talked a lot about that in terms of different software, the different other things we could do to present that, because we knew it was going to be difficult, particularly doing it on a monthly basis. That's a kind of a hurried product to put out there on a monthly basis. So there was a lot of thought that went into that. I'm going to get into that in more detail in a second. And then this whole viewpoint, which as Dr. Frank was mentioning, which has come out in a series of policy briefs in terms of this post-COVID economy. And the question is, do we go back to normalcy pre-COVID with the inequalities and inequities that we saw despite record employment and low unemployment numbers? Or do we go to something different, a more resilient economy, creating opportunity in the community, not only for the residents, but also opportunities in terms of the types of industries and occupations that need to be in place to create not only the opportunities, but to make South Florida in particular much more resilient and less vulnerable to economic shocks. So, well, we put together a research rationale and design standards early on to follow, because we thought this was going to be very important for you in particular, the audience for this. We wanted to hold this very high to our standards, and certainly the standards of these types of data sources and the types of presentations of this level of analytics that we see on a monthly basis from other sources as well. So as Dr. Frank said, holistic and integrated, the interconnectedness of these topics was so important, knowing from day one that it was COVID that was driving the economy. And we had to look at that in terms of all those topics, but not only that, but as we discussed in the policy brief, the fact that there is there's some variation in terms of the weight, which Nika will get into in a few minutes, in terms of what are the real drivers, in terms of what are the lead indicators, the coincident and lag indicators. And we're going to talk about that this morning, because that's really important in understanding not only how all this gets integrated, but how it gets properly weighted as we go forward. Then, of course, it needs to be transparent. You need to be able to observe the analytics that we've developed, and to be able to use the type of software to display it on a monthly basis and on a quarterly basis to make it easy. And that means it needs to be accessible, so handy and easily navigable for anyone who logs into the website and use it. The other thing is it needs to be detailed, because we need to make sure we're answering all the questions. We're talking about something that's more holistic and integrated, but it also we have to make sure that we're capturing all the indicators. Now, obviously, some of these indicators are not available on a monthly basis, but we think most of them are. So that's why we've created the monthly index, but the quarterly report is going to capture those that level of data and analysis that fills in the gaps. So that's going to be a very important aspect of the continuing research, and it will enable us to get into some level of detail and analysis that we won't be doing on a monthly basis when we release the actual index itself. So we'll talk about that as well as we go forward this morning. The next one is adaptable. The next standard that is to make sure that it's transferable. That was a discussion we had day one. Obviously, we do our general market is South Florida, Miami-Dade, Broward, and Palm Beach, and certainly the Keys. So we started there, but obviously we thought that it ought to be transferable to other counties, and it ought to be benchmarked against obviously the state of Florida and the nation as a whole, to make it really relevant in terms of the level of recovery that each of our counties are going through. Now, that said, and Dr. Ilcheva will get into this, a lot of this thinking did evolve from another model that we created this past year, which was the COVID-19 Community Distress Index. Now, this does drill down to the community level, the municipal, neighborhood, to determine what's going on within certain population groups or certain geographies. So we won't be addressing it on a monthly basis. We'll discuss it on a quarterly basis at a certain juncture. But also that is another parallel model that we've been working with, and it's been used in a number of different studies to date, and Dr. Ilcheva will get into that. And then the flexibility of it. New data is coming out all the time, better data. We use both public and proprietary data sources, but we're always looking to improve upon that. Obviously, things change on the ground, in terms of the economy, in terms of the housing market. So we always wanted to make sure from day one that if this needed to be flexible, if we had to adjust it in any way, we could do that. So those are the standards that we use. That was the rationale and design standards that we set forth early on. And obviously now we're set to release it, and we're quite proud of the product that we'll be showing you. So with that, I'm going to turn it over to Dr. Maria Ilcheva, who will get into that 10-month preview of where we're at today. Thank you.
Before Dr. Ilcheva speaks, we're going to pass it along to Congresswoman Salazar from the U.S. House of Representatives, so that she can have some opening remarks on our COVID-19 Economic Recovery Index. Congresswoman?
Me just unmute myself. How are you? Wonderful to be with you. And thank you to Dr. Frank and to the other experts in this COVID-19 Economic Recovery Index. I am sure, and I'm a witness that FIU is one of our nation's leading research institutions. And what I'm hearing this morning is extremely relevant. I am sure that that you guys are aware that that I created or that I have been assigned or named to be part of the Small Business Committee in Congress. First of all, I wanted to thank all of you for giving me the opportunity to reach out to you and to the community and explain how involved and how attentive and how important it is for me to help the small business community of South Florida. As I was saying, I was named to the Small Business Committee. And last week, we voted and we passed a different amendments that, for instance, $25 billion for restaurants, $15 billion for EIDL, which is the Economic Injury Disaster Loan, $7 billion for expanded PPP eligibility, and many more resources dedicated and specifically geared to the small business community in South Florida. I also wanted to invite you to come to the Prosperity Center and tell all the community leaders that you are in touch with, small business owners, those people that care about the small business community, that within my congressional district, we have created something that is very innovative and something different from any other congressional office in the country, which is we've created a Prosperity Center that is to help those small business and those constituents who have been affected economically speaking because of COVID. The Prosperity Center is going to have 3 major components and 3 goals. Number 1, to help you find a job. If you lost one, we can definitely point out you in the right direction and where to go and find another one. Number 2, help those people who want to learn how to do something different, a new trade, welder, electrician, construction, any type of trade that you want to learn, we can point you in the right direction. And the third, which is the one closest to my heart, is to really achieve the American dream, which is to work for the government from the private sector. What does that mean? That means that if you want to become a vendor to the feds, the best clients in the world, we will help you do that. And I'm not sure if you guys are aware that there's $175 billion available for small business owners that belong to minorities to buy or to sell their goods and services to the federal government. That's what we're here for. This is the moment when we need to find jobs and to join forces with the university, with FIU and this panel that is so distinguished and knows very well that we've lost 700,000 jobs. We've regained some, but we're still short. We're still 300,000 jobs short of what we were before. So I thank all of you very much. Thank you for the opportunity, and please reach out to us in any way we can help you from my congressional office in Miami. I'm not sure if I can give the phone number. I'm sure that Nina has been in touch with some of you guys. So please know that we're here to help you and to help everybody that lives in district number 27. Thank you. I yield back, like we say in Congress.
Thank you so much, Congresswoman. We will now have Dr. Maria Elcheva talking on assessing the COVID-19 impacts of the South Florida economy. Thank you so much.
Thank you from me as well, Congresswoman Salazar. Many of the topics that you covered and the importance that you assigned to them is certainly something that we've been looking at over the past 11 months. I'm happy that our goals align, and we will be happy to assist you and other decision makers and community-based organizations through our work.
Yes.
What I will do in the next few minutes is give you an overview of some of our work in the past 11 months. That, as Dr. Murray and Dr. Frank mentioned, provides the foundation for the recovery index. It was actually exactly 11 months and 1 day. March 16th was the last time when we all met in person as we transitioned to remote work. But these past 11 months have been spent on writing reports, policy briefs, and through webinars, providing a lot of the information that I will show you to our community and to our leaders to increase awareness of some of these challenges for South Florida, for South Florida's economy, and to guide them as they develop policies to address these challenges. In April 2020, we presented, as Dr. Murray mentioned, the COVID-19 Community Impact Rapid Response Model that was developed by my colleague, Dr. Murray. That model provides a dynamic and systematic approach for identifying the types and levels of economic and social distress within neighborhoods. It also provides a framework for developing rapid program responses that are efficient, impactful, and evaluative. One element of the model is the Community Distress Index, which identifies and maps economic and social conditions according to established neighborhood boundaries. A second element is the Community Resource Assessment, which identifies the location and types of services and programs available to residents, and a gap analysis of type, quality, and accessibility. A third element, based on the above, the model produces community rapid response strategies that address a range of community issues, including economic relief, medical and public health services, food insufficiencies, employment services, etc. And the final piece of the model is the performance and evaluation, which evaluate the effectiveness of programming and create a feedback loop to listen to and engage impacted populations and neighborhood community-based organizations in program quality, effectiveness, and accountability. An important feature, as I mentioned, is the community in the model is the ability to adapt to economic and social variations among neighborhoods to enable design of these strategies and programs that are tailored to the most pressing needs of these neighborhoods. What you see here is an example of the Community Distress Index, illustrating levels of distress on a block group level for Miami-Dade County. Each block group index was calculated based on a number of variables that include population below poverty, unemployment rate, median household income, cost burdened owner and renter households, etc. This portion, this map and the Community Distress Index was developed by my colleague Nika Zirianova, from whom you'll hear later on as well. Some of the most important regional characteristics that we typically track and we have continued monitoring in the past year include population, employment, business composition, and productivity. And you see here in some of the statistics that we've been looking at as a way, again, to establish a foundation, a baseline upon which we can build programs and indicators for the recovery. Our population, as you know, has been growing at a rapid pace, and we were projected regionally to add another 250,000 residents between 2019 and 2024. Job increase or job creation has kept pace and actually outpaced population growth, which means that our economy has been able to absorb these new residents. Our job growth actually has been higher than the national job growth. And I also want to note that our GDP, our region's GDP, increased by over 3% from 2015 to 2019, and represents about 34% of the state's gross domestic product. This is an important measure because it represents the final market value of all goods and services produced in South Florida and is an accurate indicator of the size of our economy. GDP growth rate is probably the single best indicator of economic growth that is considered by economists from a large picture view. The development of successful strategies to develop the economic, to address the economic challenges of our region is dependent on a thorough understanding of who lives and works here and the types of economic activity of our businesses and workforce. Almost half of our region's employment is in the top 5 sectors: healthcare, retail, hotels and restaurants, construction, and professional and technical services. The government sector that you see here also includes all the public administrators in our region, federal, state, local employees. In terms of GDP, gross domestic product, real estate, wholesale trade, and the professional and technical services sectors account for about 35% of our region's gross domestic product. The top 10 sectors, including government, represent over 3/4 of our region's GDP. What you don't see here in the table on the right is accommodation and food services, which if government is excluded from this table, would be the 10th sector with about 15.5 billion adding to our region's gross domestic product. All of this data represents some of the indicators that speak to the strengths and weaknesses of our economy. Here I want to just show you an example of one of the analytics or one of the analytic exercises that we conducted back in April as we were estimating, given the conditions at that time, what could be the potential cost or impact of the pandemic on some of our very visible sectors. The economic impact analysis on these two industry subsectors, hotel and cruise lines, shows that the impact was indeed significant. I don't want to go into too much detail, but I just want to note that even with the recent bounce back that we're seeing in the hospitality sector, certainly occupancy rates and staffing levels and revenues are higher than they were back in April, but they're nowhere close to what they're supposed to be at this time of the year. In other words, these impacts across sectors are continuing to be felt, and we're certainly attuned to that, so that we will be analyzing them in our quarterly reports. Early on, we were also keenly attuned to the fact that the pandemic caused an extreme shock to our economy from the perspective of employment. Claimants in the first 6 months from April to August represented about 29% of the labor force in Miami-Dade, 27% in Broward, and 23% in Palm Beach. The sector, unsurprisingly, with the highest claims was accommodation and food services. As Congresswoman Salazar mentioned, after these initial few months, we have seen improvement, and that's reflected in the comparison from December 2019 to December 2020 in terms of employment. The job losses, when we compare these 2 months, have been about 150,000 private workers. In addition, there were almost 22,000 government jobs that were lost, as shown in that month-to-month comparison. We should also note that many of these industries, many of these sectors employ women and minority workers, and these job losses are disproportionately impacting certain groups in our community. Another challenge we have been observing is the small business composition of our economy. We are known for high entrepreneurship regionally. We have about actually 200,000 employer firms and almost 1 million non-employer firms. And our economy is primarily comprised of micro businesses from the perspective of number of establishments, or small businesses, with about 98% of our businesses employing fewer than 100 workers. The Miami area also has had historically higher rate of self-employment than United States. In United States, about 15 million workers, or almost 10% of the workforce, were self-employed. While in Miami, the self-employment rate was about 14%, over 400,000 workers for the region. That rate has been growing in recent years. And I should note that the growth has been primarily due to among people who are engaging in self-employment to earn supplementary income and for a short amount of hours. Also, the economic scale of these activities has not increased greatly when measured as a share of hours worked or compensation earned. The final topic I want to highlight, and that my colleagues, Dr. Ned Murray and Nika Zirianova, our research specialists, are continuously monitoring and certainly accounting for in the recovery index, is the impact on housing. Even prior to the pandemic, South Florida had a very high percentage of cost-burdened owner and renter households. Cost-burdened households pay in excess of 30% of their income on housing costs, while severely cost-burdened households pay more than 50% of their income on housing. The table you see shows the number of distressed renter households for each county, with Miami-Dade showing the highest number. The calculations for the potential increase in distressed renter households in the last few columns here are based on 2019 government data from the American Community Survey and account for jobs and wage losses for households. If we had a housing crisis before, it has now reached unseen proportion, and certainly we will continue seeing that impact as the months progress. The eviction moratorium is delaying the full impact from presenting itself, but we anticipate, without strengthening our economy in terms of jobs and wages, the likelihood of a large percentage of households facing eviction or foreclosure will stay high. As a side note here, the US Census in its household pulse survey based on responses from residents estimates that approximately 1/3 of households in the United States based on, again, self-responses will likely experience foreclosure or eviction. In South Florida, that percentage is 43. So 43% of South Florida households indicate that they're likely to face foreclosure or eviction. I will end with remarks about why we have been following all these measures of South Florida's economy consistently over the months. The first obvious reason is because we need to know all the challenges we have in order to develop evidence-based strategies for addressing them. One side of it is meeting the immediate needs of residents, businesses, governments, and nonprofits, and providing them with the resources to survive and thrive. But beyond the immediacy of these challenges, we also need to consider what long-term strategies we should design to strengthen the pillars of our economy. As we've noted in previous webinars and our policy briefs and recent reports, to make our economy resilient, we need to find room for industry to grow, expand, and prosper. We need robust small business assistance programs that encourage growth in a diverse set of industry sectors. The severe job losses in certain job sectors that will be slow to recover requires rethinking of workforce development, both in terms of retraining workers, but also making significant improvements to current workforce training that is nimble and focuses on relevant skills building. The economic recovery also gives us the opportunity to reimagine our economy and rebuild in more equitable, inclusive, and socially responsible ways. As Dr. Murray mentioned, in our quarterly reports, we will focus on some of these issues towards the goals of building an inclusive economy and not returning back to normal, but creating a new economy that is more inclusive. And now I will pass the screen to my colleagues who will start showing you some of the specifics of the recovery index. Dr. Murray already covered some of the baseline assumptions and effort that went into it. Now we will explore what the index shows and how we developed it in more detail.
Thank you, Maria, for your presentation. Let me just share my screen. Hello, everyone. Thank you for attending today's webinar. My name is Nika Zaranova, and I will take you through some of the technical aspects of the COVID-19 Economic Recovery Index, which would include development process, methodology, and calculation of the index. I want to start my presentation with the why and the purpose of the index itself. What I originally had in mind is to create an analytical tool that tracks key community indicators and measure the status of the economic recovery from COVID-19 pandemic at the county level against state and national statistics. The index would also provide an important policy tool for identifying more resilient economic development strategies and programs to make the South Florida economy less vulnerable to future economic shocks. The impacts of COVID-19 recession and the road to recovery differ widely across from local economies. However, we wanted to create an analytical tool that can be duplicated and applied anywhere in the country. We began our thinking process with outlining key metrics and indicators that would illustrate significant economic impacts of the pandemic. Then that led us to the next question. What are the lead and lag indicators? The index is based on the assumption that COVID-19 pandemic is the main driver of the economic recession. Essentially, the COVID-19 pandemic is both public health crisis and economic crisis. If the index has lead and lag indicators, then how the economic recovery may look like. Levels of optimism and pessimism about its potential recovery can vary greatly. The current state of pandemic is no exception. Due to varying frequencies of data releases, we created both monthly and quarterly tracking systems. Current slide shows the data indicators that we selected for the monthly index. The monthly index includes 7 key COVID-19 health, economic performance, and housing affordability indicators. The data comes from a combination of sources, both public and private providers, as Nanette mentioned before. The traditional government statistics and metrics mainly come from Bureau of Labor Statistics, State of Florida Department of Economic Opportunity, DEO, and Census. Some other data was extracted from organizations such as Burning Glass Technologies, Association of Realtors, National, State, and Local, RealPage, and others. As I just showed, the index is comprised of several data indicators, which are expressed in its own unique way, whether it's in numerical or percentage. For example, unemployment rate is expressed as a percentage, and number of infection is expressed as a number. So the calculation of the index involves 4 different steps. Number 1 is normalizing the data indicators by placing them on a common scale from 0 to 100. Where 0 represents the lowest possible score and 100 represents the highest possible score. The second step was averaging rescale scores together with each of the indicators of the index. So each indicator will be comprised and illustrated for specific months. The third step was assigning statistical weight for each of the variables, where lead and coincident indicators are assigned a greater weight than lag indicator. And the final step was adjusting for the selected base period, which was January 2020, measuring health, economic, and housing affordability activity relative to pre-COVID levels. So January 2020 would have a score of 100 across all the selected geographies. Our economic recovery index is supplemented by quarterly series, which provides us deep dive analysis on pandemic statistics, unemployment figures, industry sectors, and housing market trends. I want to highlight again that in our index, COVID-19 indicators are the main drivers of the economic recession and economic recovery as well. Vaccine distribution would play a key role in this and be viewed as an economic boost. Also, due to the nature of South Florida economic base, we are closely monitoring specific industry sectors such as tourism and hospitality, as they were hit the hardest during the pandemic. It's also important to know that in the quarterly index, we included the real unemployment numbers, and this rate accounts for anyone who has been seeking employment within the previous 12 months, but have not been able to secure a job. It accounts for gig workers and people who are underemployed or working part-time hours. The official unemployment rate does not account for those workers like the real unemployment rate does. Without these numbers, the official unemployment rate can grossly underrepresent the degree to which the economy is not meeting a sufficient allocation of jobs to skill levels and personal preferences. We also included foreclosures and evictions, as when moratorium is lifted and payment assistance is no longer available for renters, these two categories will see escalating numbers. Now I'll take you through the index itself and its changes in the past year for the United States, Florida State, Miami-Dade, Broward, and Palm Beach counties. As you can see, for the January through February, we saw the economy to remain flat, and in some instances, there were improvements. For example, unemployment rates decreased by 0.1% for the United States, Broward, and Palm Beach counties. Also, we did not experience any COVID-19 symptoms just yet. When lockdown orders were placed, we experienced a significant economic drop. We saw a rapid increase in infections across the nation, and as a result, the US unemployment rate increased from 3.8% in February, among the lowest on the record, to 14.7% in April. Florida and Tri-County area has followed a similar path in unemployment numbers. And we also saw spikes in first-time unemployment claimants coupled with job losses across the industry sectors. Combined, 3 counties lost approximately 374,000 jobs in April. In May, we saw a decrease in COVID infections, and they remain lower in June than peaks that we've seen in March and April. With adjustment to a new normal and creating new ways of doing business, labor markets added more jobs, which in turn lowered unemployment rates. July was the worst month of COVID-19 infections in Florida across 3 counties. That triggered unemployment numbers to go back into March and April levels. Miami-Dade County unemployment rate of 14.5% in July was the highest out of the entire 12-month period. An escalating number of infections again triggered job losses across the Tri-County area. August through October economy saw some positive trends and signs of a recovery. October across the nation, optimism was on the rise, and that period of time is associated with decrease in infections, job creation, lower unemployment rate, and less people seeking assistance. In November through December, the economy turns down again, and in November through December, US sees a record number of COVID-19 infections, an estimated 6.3 million of people infected. Florida and 3 counties experienced another wave of pandemic outbreak as well. In December, rental housing markets saw a decrease in number of renters that were able to make their rent payments. Total home sales surged as robust pent-up demand and record low mortgage rates fueled transactions across all the presented geographies. Miami-Dade County single-family home price increased by almost 20% year over year in December 2020, increasing from 380,000 to almost 455,000. Broward County single-family home prices increased by 13% year over year, reaching the median price of 430,000. And Palm Beach median home price of 425,000 rose by almost 17% year over year in December of 2020. With that, I want to thank you for attending our webinar again, and we will continue tracking the index and indicators both on monthly and quarterly basis. And I would like to pass it to my colleague Camila Masson to show you how to access the index on our website and how to navigate. Thank you.
Thank you so much, Nika. So let me go ahead and share my screen and show everyone how to access our recovery index. So you can access the COVID-19 Economic Recovery Index through our main Jorge M. Pérez Metropolitan Center website. It is metropolitan.fiu.edu. When you see our first home screen, you're going to go ahead and click on the Recovery Index tab here on our banner. This tab is going to take you to the main page, the main Recovery Index page. Here we have our press release that accompanied our COVID-19 Economic Recovery Index. And as you scroll down, as you read the press release, you can scroll down and here's a link to the accompanying policy brief that Dr. Murray has talked about and Dr. Frank as well at the beginning. You can click here and you'll be able to read the full policy brief. And also here, it tells you how to access the actual full recovery index. You can view the full recovery index by clicking on this cover above. So it is a clickable link. Before I show you the full index, I just also wanted to show you the methodology that we have here. So we have the full methodology that Nika just explained through this methodology tab. And we also have our release schedule. So this is the estimated release schedule for the index through December of 2021. So this may be subject to change, but as of right now, this is our tentative estimated release schedule. You can always find it here. If we have any changes, we'll update it on this tab. So let's go back to the main page and I will show you the recovery index. So once you go ahead and click this, you'll click this and it's going to take you to the main economic recovery index page, so you can see the full index. So as a disclaimer, for optimum viewing of our index, I suggest that everybody goes here to the bottom corner and presses the full screen mode. This is the best way to view our data. Everything looks better in full screen mode and it's easier to make comparisons. So on the right-hand panel, on the left-hand side, we have a brief introduction to the recovery index. We have our most recent monthly score by location. And here we have the arrows that indicate whether or not the score increased or decreased from the previous month. So from November of 2020, we saw a decrease from November to December because we had a lot of COVID infections in December of 2020, so it decreased significantly. And here you can see like the percentage of decrease for each location. So here on this panel, we have our main trend line analysis of the overall recovery index score that started in January 2020 as our base to December of 2020. So here you can go ahead and filter out this chart by location. If you want to see, the analysis for all the locations that we looked at, you can. If you want to just look at the Tri-County area, you can untab Florida and the United States, and you'll just have the trend lines for the Tri-County area, or vice versa. If you just want to compare Florida and the United States, you can do that as well. So this is an interactive chart. All the charts are interactive. So as you hover over the trend lines and for each month, you'll be able to see the actual score. So if you want to see the score for Miami-Dade in July, you'll be able to hover over here and the score for that month and that location will pop up. So then if you want to do a deeper dive of our data that we put into the actual main recovery index score, you can go ahead up here. These are all 3 clickable buttons. You can go ahead and click our data button. And it will take you to our raw data page. So this raw data page is a different size than the first page. That's why viewing it in full screen is your best bet. You're going to be able to see all of the data clearly in this full screen mode, and it's going to be much easier to analyze data and to switch between locations. So up here we have our legend, so you can see which location is which color. Miami-Dade is yellow, Broward is green, Palm Beach is blue, and United States is gray, and Florida is orange. So you can always have that to reference at the very top. In each of these charts, we put a drop-down menu so that you can go ahead and analyze the data through the different locations as well. We have it set up so that when you first look at this raw data page, you're seeing the Tri-County area because that was our main focus for this specific release of the index. But you could also go ahead and just compare the United States. You can just look at the United States scores. You can add United States and Florida to the charts, or you can take out the Tri-County area and just compare between the United States and Florida if you want. And so you can go ahead and do that for each of the charts. And then also, this is also another, these are all interactive as well. So once you hover over the location and the different data points, you'll be able to see the actual data. So if you want to return back to our main dashboard after you've looked at this, you've analyzed your data, and you want to go back to the main dashboard, you can go ahead and click our main dashboard button up here at the top. It's going to take you back. If you don't want to go to our website to look at the methodology, or you just want to look at the methodology quickly while you're still in the index, you can go ahead and click our methodology tab, and it's going to take you to the exact methodology that's on our website. You can read through it here. You see the different index indicators and the data sources. And then if you want to return back to our main dashboard, we have that button here as well. And then we also have a preview of our policy brief on here. So you can come and you can read the overview if you want, and then there's a direct link to the full policy brief that's on our website. This picture is also a clickable link that you can click and it'll take you to the PDF version. And then you go back to our main dashboard. And that is how you interact with the economic recovery index that we developed. It's very simple and user-friendly, and you can always reach out to us at our Met Center at FIU.edu email if you have any questions. So now I will pass the mic back to Dr. Murray to wrap up this webinar. Thank you. Dr. Murray. Ned. Dr. Murray may have frozen for the time being. So it looks like we lost Dr. Murray. I think he's logging right back in though.
Yeah, I'm back. Am I back?
Okay, yes, you're back. Okay, so you could go ahead and share your screen and your last wrap up.
Okay. Sorry about that.
It's okay.
So the quarterly report, as we discussed, is going to address in a much more detailed way what the COVID-19 Economic Recovery Index is really intended to do. So obviously, as I think was mentioned, some of the data is released on a quarterly basis. So that's why we want to be able to incorporate that in the quarterly report. And it will also include the narrative, as both Nika and Camilla showed. You know, the index itself, the monthly index, is very analytical, very detailed from that standpoint. But the narrative behind it, in terms of what's happening relative to COVID, what's happening in terms of all the various issues or the impacts relative to the economy, the housing market, all those things have got to be explained somewhat, and so that's going to be part of what we will do as we drill down on in the quarterly report. So within that, we obviously want to focus on industry sectors, particularly those industry sectors that are really important to South Florida, that being tourism and hospitality, obviously the transportation sector with the cruise line industry and the airline industry, retail. So we want to be able to focus on those on a quarterly basis and discuss not only what the trends are, but what are some of the projections based upon our analysis and the analysis of other economists. Economic trends and projections overall. We want to be able to talk about what particular sectors that may not be part of our portfolio, so to speak, in South Florida, such as manufacturing or other industry sectors that we certainly are keeping an eye on, and we've discussed in the past. We want to see how those industries have taken hold. We want to look at particularly the retail sector and what's changing in the retail sector as we see more less and less retail being built and more logistics being built and replacing retail in a lot of these locations. Various changes in the housing market, not only in terms of the housing types, but the locations of housing, who's buying up the housing in South Florida. Obviously, the market has changed substantially since the summer, and that's a big issue relative to affordability, which is always one of our points of emphasis, because we do see that as a major issue. Now, I did see there were some questions, some chat going on relative to what happens if say, evictions moratoria are stopped, or foreclosure activity starts up again. And these are real issues. These are those lag indicators that we talked about earlier that we really anticipate at some point will take more of a hold. Now, obviously, we all know that the reason they haven't to date is because of the moratoria on both, but we do anticipate at some point they will begin to impact the South Florida economy as they did, particularly from a foreclosure standpoint, following the Great Recession. We were having still heightened levels of foreclosure activity all the way up into 2013. So these are the things that we're going to be looking at on a quarterly basis as we absorb the months previous in terms of what we've seen, but also, like I said, the trends and projections based upon some of the industries and some of the other economic data that we'll be looking at. So with that, I want to thank you, and we're glad we were able to leave a good chunk of time left, because I'm sure there's a lot of questions and answers. Obviously, as Camilla said, it's the rollout is today, so the COVID Economic Recovery Index is available now on our website and will be available on a monthly basis. So with that, I turn it over to Alex, and he will facilitate the Q&A. Thank you very much.
Thank you. My name is Alex Anaki. I'm a research assistant at the center. And so if you have any additional questions, please feel free to leave them in the Q&A section. The first question I'll start with is from Rob. He asks, what was the biggest source of distress for the most distressed areas on the map, and which areas experienced outsized levels of distress relative to how distressed they were prior? Would any of our panelists like to take that one?
Well, I could, and Dr. Ilcheva did discuss that. We have to remember that going back to March and April, we saw something we've never seen before in terms of job loss. 10 million jobs were lost in the first month. Nothing has surpassed that. So obviously for South Florida, and particularly Miami-Dade, tourism and hospitality were hard hit right off the bat. And as Dr. Ilcheva has documented, going back to our earlier webinars, the cruise line industry, obviously, and the transportation sectors as a whole, including airlines. So those are the ones, they make up the core employment base of South Florida. So those are the ones that were hardest hit. If you want anything to add to that, Maria?
Yes, I just want to mention that in terms of geographic areas that were hardest hit, these are the areas that we see a high concentration in poverty, a high number of cost-burdened households, even before the pandemic. So basically, the communities that lacked the resources before the pandemic, that negative outlook for the communities was magnified by the COVID-19 virus as a result of the job losses and wage losses and business closures in these particular communities. We've talked in our previous research about the spine of distress, and you certainly see that if we map out these distressed communities for the whole South Florida region, you'll see it overlapping with the spine of distress, basically around the US 1 I-95 corridor from Miami-Dade through Palm Beach counties.
All right, thank you. Our next question is from James. He asks, will the housing market trends and projections be broken down by municipality and ownership versus rental, as well as how many years out are you projecting on those categories, both market and affordable?
The housing market data, as all the data that we have, is done on a countywide basis with the state of Florida, the nation, as the benchmark. Now, in the quarterly report, because we are so focused on this issue of housing affordability for the past 15 years or so, we will get into that because, as Dr. Ilcheva has showed in one of her slides, we know that the level of severely distressed renter households, those who are paying in excess of 50% of their income on rent, has grown exponentially for the reasons that Dr. Ilcheva just stated. So we're going to be tracking this very, very closely because it ties into the other point that Dr. Ilcheva had mentioned, that these are the very industries and occupations that have been so impacted, and the populations themselves. These are distressed communities pre-COVID, and now obviously they've been the most vulnerable post-COVID. So we will get into that. The stress index that Dr. Ilcheva displayed allows us to do that. Now, the level to which we do that on a quarterly basis will really be determined by a number of factors, including what happens in Washington relative to moratoria on both foreclosures and evictions, but also what happens relative to whether any of these sectors that employ so much of our population are able to rebound, or if we have another spike in COVID, do we go the other way? So a lot is going to happen. That quarterly report is going to be very dynamic, and it'll be based on a number of things, but once again, COVID being the main driver. But then our main industry sectors are going to have a lot to say about that as well.
Okay, thank you. Our next question is from Camila. She asks, how is the recovery affecting immigrants and informal sector workers? Are they included in the index?
I'll take this question and my colleagues can add to it. The recovery index, as it stands now, the monthly recovery index, presents broad indicators of economic recovery. As such, it doesn't do a deep dive into specific communities or specific populations or even specific industry sectors. That will be our goal, though. And some of my colleagues and I mentioned our quarterly indicators, our quarterly edition, to put it this way, that will be accompanied by what we've produced over the years, policy briefs. So each of these policy briefs will focus either on specific populations or specific industry sectors. They will have a more defined focus, and certainly the informal, the gray economy, and immigrants, as well as specific racial and ethnic groups, particular sectors, will be the focus of these policy briefs. So stay tuned for our quarterly updates on these topics.
I should also mention, and that's why it's important to go back to the webinar series we did last spring. We had a whole webinar that touched upon this, and we were glad to have Unidos USA with us. And we will be doing some work going forward with Hispanic Unity USA. So we're going to be focused on this particular issue because it was very pronounced. And when we had our webinar back in the spring on nonprofits and those organizations that deal with immigrant communities and immigrant workers, and we've also worked very closely with Central Campesino, of course, down in South Dade. So this will be a focus. We are very mindful of the population groups that comprise South Florida and the ones that have been most impacted. And certainly immigrant workers have been severely impacted.
Okay, we have several new questions. I'll start with the first one from Tom. He asks, do you have any data giving hints to areas that may experience a higher rate of evictions post-moratorium? Same for foreclosures, post-forbearance practices?
Well, if I follow the question, it's what specific geographies are going to be most impacted? Okay. Well, once again, going back to the distress index that we showed, that's something we do monitor. We've been monitoring for some time now with the prosperity study that we did some years ago that sort of provided the platform for looking at communities at Dr. Ilcher brought up earlier, at the neighborhood level and even at the block root level, because we know the spine of distress that extends certainly in Miami from the border of Miami Gardens all the way to Florida City, but as she said, all the way up 95 corridor into Palm Beach. So we know, we have a good sense based upon the studies we've done to date where these locations are. These are the areas we're going to be focused on. We know just by the records that we have, the data that we have on eviction filings, that it's going to be extensive should the moratorium lapse at some point. And of course, the foreclosure activity is another matter, but we do expect at some point with loss of wealth and the fact that even on the rental side, this rent has to be paid back at some point. So there's going to have to continue to be, significant investment out of Washington in order to prevent this from happening. But it's a real concern, and so we're keeping a close eye on these lag indicators because we know we know the situation in these communities, and as we said earlier, it was pre-COVID as much as it was post-COVID, but post-COVID has made it a lot worse.
Okay, our next two questions address similar issues. The first is about women's representation in the workforce, and the second addresses how many of the applicants for unemployment insurance in Massachusetts, but also in Florida, are young, people of color, women, low income, etc. So the questions are concerning, since these demographic characteristics aren't explicitly addressed within the methodology of the index, how are we addressing, for example, the impact on women's employment or the trend lines for unemployment insurance claimants in our index?
I will take that question, and we've had internal discussions already on that topic. One of the first policy briefs that we will produce is precisely on that issue, the impact on women. Some of my work over the last few years has been focused on the topic of gender equity. If you look on our website, you'll probably find the Status of Women report, 3 editions of it, and I'm working with the Women's Fund on addressing, certainly from a data perspective, but also from a policy perspective, how we can address that disproportionate impact for women, and especially Black women. I mean, we can dissect the data in many different ways, assessing the impact, and obviously, as I ended my presentation talking about creating not going back to normal, but creating a new environment in which these different communities, in which we have observed disparities for a long time, as I noted, these are not created just by the pandemic, but there have been long present disparities that were simply magnified. We will be addressing that as well as in our subsequent work. I also want to note something that we are paying attention to, that many women are simply not participating in the labor force. And again, that has been a challenge for our economy for a while. Labor force participation rates for women, not just in our community, but across other metro areas and nationwide, has been significantly lower than for male workers. There are various reasons for it, obviously family and childcare responsibilities, as well as other factors impact that. But until we get to closing the pay gap, closing that gap in labor force participation, we won't get to that new and inclusive economy that I'm talking about. So don't think we're not paying attention to these issues. That's not what that wasn't the intent of the recovery index to delve deep into them, but that's certainly something that we have been doing in our other work and will continue focusing on.
Yeah,
I'd like
also
to add
wanted
that
to-
we will be using the U6, which is, I think, a more realistic when we're looking at unemployment, that I think will deal in part with the kind of structural issues that you're raising, the type of structural issues that Maria has been dealing with in her research. And yes, I think that the participation in the labor force needs to get more attention because it deals with the kinds of structural issues that really lead to building a more inclusive or equitable economy. So I ditto what Maria has just said. We're on it.
Yeah, I also wanted to reiterate when I was giving my presentation that we created the index with an idea behind it that it can be applied anywhere in this country. So we had to create that strong base. However, as I mentioned, for the quarterly index, we're going to have a deep dive into the industry structures and industry sectors. And we've been doing it for a long time. We already know the idea of the demographic composition for each of the industry sectors and ages and gender and ethnicity. So in a way, we are addressing those kind of issues in that as well.
We have another question here, and I think I'll pass it over to you, Nika. But the question is it possible to view the data on perhaps a zip code basis to further view the inequalities in distressed areas?
Well, actually, the distress index is comprised on the block group level, so it's more on a neighborhood level. But yeah, that index can be constructed on the zip code. The community distress, the economic recovery index, is the monthly index, and we tracking the data based on the county level. And some of the data is not available on the zip code or on the city level.
Okay, are there any other questions from our attendees today? Looks like there's not, so I will pass it over to Camila to conclude our webinar.
Yes, thank you so much, Alex, for moderating our Q&A portion. Thank you to all of our participants for all of the wonderful questions that you asked. We want to thank you all so much for coming today and for participating in this webinar, for viewing our presentations on this COVID Economic Recovery Index that we developed. We're so excited for its release. I just want to let everyone know that the Recovery Index is live on our website. As of right now, everyone can go on our website, look at it, read through everything, and look at the index for themselves. And by the end of this week, we will be sending everyone a link to the video recording of the webinar. And so you will be receiving that by the end of this week at some point. Thank you so much again for everyone participating. Thank you to our panelists, and we are very excited for this index being out into the world. Thank you, everyone. Have a wonderful day.
Thank you.